What are some common TRT doses?
So we have two schools of thought here, or essentially this would be a two-part answer. The first answer is which ones are actually common out in the field, and then the second one would be which one should be common. So unfortunately, they're not one and the same, although I think we're making strides every single day in order to systemically get this into a place where people are optimizing properly. Unfortunately, the most common that you'll see is a 200 milligram single injection. And that will either be done by clinics that are quote unquote specializing in TRT, in which case they'll do 200 milligrams per week. And then you're going to have your traditional endocrinologist slash family physician slash urologist approach, which is going to give you 200 milligrams once every other week, which we know is a terribly flawed concept. Either way you chop it, you're going to receive a nice big blast of an ml or 200 milligrams of testosterone cypionate. That is the most common by far. It is wrong, it is flawed, and I don't believe anyone should be using 200 milligrams in one single dose, because that would be equivalent of eating 17 breakfasts on Tuesday and then taking the rest of the week off from food, right? So even if you do need, and again, very few people actually need 200 milligrams a week in order to replace and even optimize their hormones. But even if you are one of those people that needs a higher dose, it should not be done under a single administration. The metabolites are going to be greatly increased as a result of that big blast. And then you're going to begin to experience a crash going into your next administration for the mere fact that the half-life is not designed to carry you throughout that long of a stretch. You're going to go down at best case scenario to a 50% level from where you began, and you're going to have a hard time achieving a steady state. You're going to be on a constant roller coaster ride of peaks and valleys. So at the very least, splitting your dose up into twice a week as a starting point should be a good protocol to follow. And then from there, some guys will need more frequent dosing, and that will come down to various other factors in their labs, as well as how they feel, their SHBG and other binding proteins, as well as metabolite effect on their overall therapy. I would say that the most common dose that should be adhered to when someone first starts out is going to range between 100 and 140 milligrams per week, split into 2 or possibly 3. And that is going to be the way to begin treatment until your next follow-up. And then you have an opportunity to figure out, where do we go from here? How are we doing? How are we feeling? And how are our numbers looking in terms of doing damage or preventing damage in the long term? Because the goal of the labs, for me at least, is to ensure that the treatment that you're getting, and that is purely subjective as to how you feel, but if you tell me I feel great, I just want to ensure that we're not taking years off the back end or causing damage in other areas of your body as a result for making you feel well. So the goal is fix the guy, but also make sure that you're not harming them in the process. And really the labs are just to keep you honest and make sure you're not doing harm. They're not there to tell you, yes, you hit a number, stop, the guy is good, because if he's not good, he's not good. You still have a job to do. So ultimately, I like to start conservative. I like to give them a few weeks, ideally 6 to 8, and then have a conversation, take a little blood, figure out where they're at. And we can always move up from there. But to go and blast guys at a 200 milligram per week dose right out of the gate, I know a lot of guys like it because they're in it for the wrong reason, but that is not the way to replace a deficiency by any means. And it's just, there's too much risk involved in having to play catch up later on down the road.